We're at week 2. We're moving fast. By the time, um, before we know it, you guys are going to be done with the module. Okay. But we have our quote of the week. I always put day, but it's quote of the week. Um, we have a couple things that we're going to kind of cover. I mentioned them last week, but just in case we forgot, we'll talk a little bit about the presentation papers that you're not presenting, you're just submitting them to me. We have our group work. I know one person is not here, but they already submitted their information for the group. A couple videos and a Kahoot. Okay. Now, the quote of the week. Everything you want is on the other side of fear. As surgical technologists, you're going to face moments of fear, whether it is stepping into the operating room for the first time or mastering a complex procedure. But fear is not the enemy, y'all. It's a gateway to growth. Each time you push through it, you become more skilled, more confident, and prepared for the career you're working towards. I want you to remember that success and fulfillment you seek are on the other side of that fear. Embrace the challenge, take deep breaths, and you will find the rewards waiting for you. Okay, so mini lesson is up already. Chapter 1, instruments, looking at care of instruments, and then your setup guidelines. Here is the link is up, so just make sure you kind of go through it. And then week 2, you have your sterilization paperworks. Okay. I highly encourage you guys to, is this going to get me? Hold on, let's go down to it, to your sterilization paperwork or sterilization paper. I keep saying paperwork. Okay. So you have your sterilization papers. Okay. You have your instructions. You will be assigned. You've already been assigned instruments, scope, light cord. You have your instrument. Okay. Use the setup. It tells you exactly what you're looking for. I can promise you, if you use this setup and you follow the directions, most likely you're going to get a very high score. All right. It's a total of 100 points. Okay. So make sure you are following the instructions, answering the questions, and then submitting it. The earlier you submit it, the better. If you can, I get it, life happens. But the earlier you can get that done, the better it will be. Okay. Where do we find the prompt again? Great. Okay. So great question. Once you come down to week 2 exercise, chapter 10, you'll click on the sterilization paper instructions, and then the instructions come up. And then here is your example. Let me make sure that this is here. This is from the last one. Give me 1 second. Let me grab yours really quick. Technical difficulties. All right, let me put this one back. Announcements. I want to say I have them here. It should be. Okay, so you have your handout. Does anyone need their assignment again of their instrument? No? Okay. All right. That's the only thing I was worried about. You do? Okay. So what I'll do is I'll put the list back up for you guys. And then that way you have the list. Normally I put it with the week 1 assignments. For some reason, I thought I did and I didn't, but I will go ahead and give you guys that back up. But to get to this assignment, go down to week 2 again. Again, here's the instructions, and here is an example of the sterilization paperwork. Now, when I did it, I chose a different instrument that no one has. I did trocars that sometimes we can reprocess. And so that's what the example is. But again, follow those instructions and then follow the example, and you will be able to maximize your score. Okay.
Excuse me, I have a question.
Yes.
Sorry. So for the template, say we use it. So like the template, it's kind of like has like questions. Do we just answer the questions or put them in
Yes.
a paragraph font? Like,
Um, Answer them in a paragraph form.
oh,
So let me see if I can pull up my example because it's not, I got to pull it, save it for you guys. So hold on, I got to share my screen again. And that's a great question. So let me get it for you. Okay. So I use the questions for my paper. Okay. I left this blank so you guys can use it. Hint, hint, you can use this. And then I left the question and then I just turned like I kind of like answered the question, but I put it in a paragraph form. So what happens in the decontamination room? So what I did is put the decontamination room is, and then I kind of went that way. Cleaning process. The refers to the removal of visible dirt. So have the actual part, and then I just broke it down so there is no questions. And again, you can just straight through the template, and then that will definitely help you guys. While I'm here, I want to make sure that you guys have the, I'm going to put this back up, but I want you guys kind of have it now so you guys can kind of write it down. Let me go and pull it up. Yes, that is a great question. So the question is, so it'd be totally okay if we submit our papers just like that. Yes. Yes. Actually, that makes it easier for me to grade because there's like 20 of you guys. So if you do it that way, that's actually perfect. But yes, please use that template if you can. Now, you can still be fancy. You could add pictures, you can do whatever, but ideally, you can use that exact template. Okay. Okay. So I'm going to share, I'm going to get the template off now, and I'm going to go back to kind of like last week's um, PowerPoint. Okay. So for everyone, here is the assignments again. Okay. Let me see. Okay, perfect. So here's the assignments again. Take a screenshot if you need to. Here are the assignments. Um, so that everyone can have them. And again, I am going to put this on announcements this evening as well, so that you guys can have them. Okay. No stress, y'all. This is just to kind of get you familiar paper wise of what you could do. So you can at least have, like, when this does happen, when you do go to clean an instrument, because you may get sent to central processing at some point in your clinical rotation. A lot of times in new facilities, they have central processing personnel. But if you go to a surgery center per se, you will be kind of like wearing a whole bunch of different hats. Okay. So that's ideally what we're, just getting you familiarized with. Okay. Okay. So for the fun, last week we were tasked. We had some surgeons come in, we had some infection control personnel, and we had some risk assessors. They all were presented with different things. Our surgeons had to focus on critical areas and surgical procedures. Our infection control specialists had to develop sterilization protocols. And then our risk assessors came in and they evaluated the potential risks of a particular scenario. So, just a recap of the scenarios for everyone. Your surgeons, you guys were preparing for a heart valve replacement. You needed to identify all critical risk zones and explain why these zones require strict sterility. For group two, my infection control peoples. You had a patient come in with severe burn wound. Okay. We didn't even talk about percent, but we're going to say 50% of their body. Okay. What Spalding category applies and how would you ensure proper infection control during treatment? And my risk assessors, you were tasked with cleaning and disinfecting an endoscope used during an upper GI procedure. So we're talking about um, endoscopic, okay, or EGDs, um, and classify its risk category and outline the cleaning protocol. Now, I'm going to start with group two, and I'm going to, one of the infection control specialists had sent in their findings. So I'm going to go ahead and say that, and then I want the rest of group two to kind of chime in. So the first infection control specialist, when they were developing their protocol, now the patient had a severe burn wound. This might fall under a critical Spalding category. To ensure proper infection control, they decided they needed to have proper hand hygiene, which is big, use sterile dressing, supplies, and equipment, and administer appropriate antibiotic and wearing PPE. Most importantly, we have to monitor for any other types of infection. So, for the rest of team two, do I see anyone else from team two here? Okay, so there is one more person. Is there anything that you would like to add in as you're like right in front of me, like you're right there? Anything that you would like to add?
I think that when it in general, like if we're talking about a severe burn wound, I agree. It should be in a high risk category. Um, um, because because we already know it's severe, so even though I guess what I'm trying to say is just we should just take it immediately as high risk precaution, as they said, gowns and the same thing to be careful with wound dressing, to have a sterile environment. But yeah, I think the same way um, it should be taken with a lot of precaution for the patient and for us as well. And of course, hand hygiene.
And you guys would be correct. Other things to kind of think about when we talk about our actual endoscopes, we regularly inspect them because we're looking at damage, wear and tear. We use this same instruments after they're cleaned on multiple patients. So, just normal wear and tear could happen. We also look at documenting everything because of the where it's going, right? These aren't necessary like sterile procedures, right? Because we're talking about the mouth and different orifices, but it's still high critical, right? Because we do not want to cross contaminate. So, great answer, my infection control specialist. Great answer. Okay, risk assessors. Let's have you go. Let's see. Okay, risk assessor. So we have Spalding category would be semi-critical. Cleaning protocol would be to kind of wipe down the endoscopic with enzymatic detergent, then fully soak the endoscope in a predetermined enzymatic detergent, followed by washing complete with water and brush if needed before using an HLD, which is a high level disinfectant. That is good. Anyone else? That is really good. Yes, which is what we do in the operating room when we do these cases. Anyone else from the team? Semi-critical because, right, because we're talking about mucous membranes, and that's really big. When you get in the operating room, you'll be surprised when you're doing a cystoscopy. Okay, it is a semi-critical as well because we're going in the urethra. We aren't necessarily cutting up in anything, right? We're going into an orifices. So we look at those particular cases because we're contacting mucous membranes. So that is correct. Good job, Mr. Shane. Let's see. Who else from your team is here? Miss Robinson, did you have anything you want to add? You can type it in. And I think that's the only one else from the group. Okay, so while we are letting Miss Robinson type in, my surgeons, most of you are surgeons. What do you have? And you may want to explain a little bit about the heart valve replacement. Not going into too many details, but kind of explaining so that everyone else understands, you know, kind of like your thought process. And you, again, you guys can type it in as well. While you're doing that, I'm going to try to find a picture of a heart valve. To kind of bring it in. Let me see if I can find a 3D. And don't be shy. Surgeons, you guys are the leaders. Perfect. I see. Okay. All right. Beautiful. You have a heart. This is from one of our surgeons. We have you have one more, but there's a word. Okay. Sorry, I wasn't supposed to read that part. Okay. You have your heart valve replacement is a procedure where a damaged or diseased heart valve is replaced with a new one to help the heart pump blood more effectively. We have heart valve prosthetics, really big surgical instruments. They got to make sure that whatever we are introducing into the heart, like that valve, is sterile so they can avoid infection. You do not want an infection in or around pericardium or heart, you guys. We have cardiopulmonary bypass circuit or CBD. It's a machine. It's used to take over the actions of the heart during the procedure. When this is when we are saying we're putting the patient on bypass. So that's when you hear that, like you hear the medical, like Grey's Anatomy or anything. This is what they're doing. Okay. They are rerouting the blood flow from the body into this machine and bringing it back to the patient. So it's acting as the heart. I love this. Drapes, team members, instruments, it doesn't matter. This is where the sterile field is maintained and the sterility of the OR prevents post-operative infections that could affect the patient's recovery time and additional complications. Intubation, where we have the endotracheal tube, it's needed to keep the airway open and help the patient breathe during the procedure. It must be properly sterilized. Again, you do not want infections, cross contamination for these patients. Excellent, excellent job. Anyone else? So they have these 3D heart replacements. I'm going to pull up for you guys so you guys kind of can see. Um, and once you guys get into module 4, you'll have more videos. You have that we're going to talk about later, Incision Academy that will really break these things down for you. So, if I can get this. So, heart valve, okay? This is what we're putting into these patients. You want to make sure that we don't really touch them much. One thing that I tend to do, and again, this is just one of the things that I do, you will learn what works best for you. You get the sterile package popped onto your field, and I keep my implant in the package until it's time to hand it up to my surgeon. And that just, in my mind, lets me know that it's going to stay contained for as long as possible until the surgeon actually needs it. Well, that's unfortunate. Okay, I will get the picture for you. I'm all like thinking you guys can see everything and you can't. Okay, no worries. I will get some imagery for you guys to kind of see exactly what the heart valve looks like. Okay, but thank you for pointing that out for me. All right. So if you had the opportunity to look at the mini session, you know that we are breaking down the parts of instruments. So you see numbers 1 through 5. And I want you to kind of just look at it and kind of in your mind, put them where you think they are. Okay. If you haven't watched the mini session, that is okay, but I highly encourage you to because it gets you really prepared to understand the instruments. I do want to stress that we know that you're going to want to have your hands on these instruments, right? You will get the opportunity, but we want to kind of give you guys the explanation of what this is before you get there, okay? So it's one of those trust the process. You will have your hands on it. Trust me, for the rest of your career, you're going to be having your hands on these instruments. So you have 1 through 5, okay? Give you a couple seconds to look at it, and then let's see if you got it right. Again, this is all integrity. And let's see. How did you guys do? Looking at it, feel pretty comfortable? Thumbs up, feel comfortable? Screw joint, tips, blade, shank, and fingering. So if you have the opportunity to watch that mini session, it's a couple little games like this where you'll have the instrument, give you a couple minutes, usually about 30 seconds. Next slide, test yourself. Okay. Um, Next week, in week 3 and week 4, we have Quizlets already made that has all the instruments. I took the time to go through the book and add those up for you guys. They're up and ready. So next week you will have those Quizlets and we will grab different instruments and explain what they do. I'm going to try to find images showing you how they're used. Okay. Now, finishing up with chapter 10. Okay. We're just going to talk about principles of gas sterilization. We look at surgical environments, right? That's where we work. That's our comfort zone. But there's critical areas of the body, surgical site, internal organs, that heart valve replacement, that's huge, okay? There's other areas where sterile procedures are just going to be required and everything has to be maintained and kept sterile. Anything that comes in contact with areas must also be sterile to prevent infection. We do not want an SSI. We don't want an HAI. So we don't want a surgical site infection or a hospital acquired infection, right? Now, you have terms. Disinfection is going to be different from sterilization. You have to understand the difference. Disinfection. The process reduces the number of harmful microorganisms, but does not make the item completely free of all bacteria, viruses, or spores. Disinfected items are not, I will repeat, disinfected items are not considered sterile. Your skin can be cleaned, but your surgical scrub is just reducing the amount of microbes on your skin. Okay. Skin is not going to be sterile. Sterilization is the only process that guarantees an item is completely free from all forms of microbial life, including bacteria, viruses, and spores. So in surgery, items like our surgical instruments, our gloves, drapes must be sterilized to ensure that they are safe and going to be used in these important areas. That means we got to know the difference between maintaining a sterile field and preventing contamination during procedures. And you're going to learn how to become extremely multitaskful in the operating room. Now, advances in technology, economics, and a focus on patient and personal safety have changed the, I want to say, selection criteria for surgical instruments and procedures. So there's new tools like robotic systems. They come in and they allow for just a more precise and minimally invasive surgery. Cost effectiveness encourages the use of reusable instruments and better resource management. And then we talk about safety. Patient and staff safety is prioritized. We want to reduce risk, especially of infection, and then they don't want injury in the operating room. We look at sterilization methods. They're only effective when certain conditions are met. Temperature, time. Each instrumentation method requires specific temperature ranges and exposure times to kind of kill microorganisms. Okay, so depending on what you use, it's kind of like you get Clorox with bleach or you get the generic cleaning that doesn't have the bleach in it. Well, one is going to be very strong, first of all, and it's going to kill everything. And the other one is probably going to smell good. Okay, kind of the same thing. Some methods, like autoclaving, rely on pressure to achieve the necessary temperature for sterilization. All surfaces of the item being sterilized must be exposed to that sterilizing agent. It doesn't matter if it's steam or gas or whatever you're using, without any obstruction. Meaning, when you place the item into the autoclave or the machine, you want it to be in a way where every part of the surface can be touched with that temperature, with that steam, with that gas. Now, items must be properly cleaned before sterilization to ensure effectiveness. You'll hear some techs saying, "Oh, I'm doing dishes today." And you're like first time I heard it, I was like, "We've got dishes." Well, we do have spoons, but that's a whole nother story that we use in the operating room. But they're the individuals that are starting in decon. A lot of times in the surgery centers, like I mentioned, we rotate. So you may go from pulling your case to setting up your room to scrubbing your case to breaking down your case and then washing your instruments and preparing them for sterilization. The biggest thing is meeting conditions, trying to completely remove harmful microorganisms, bioburden, making the items safe for use in the surgical procedures. In modern sterilization, several methods help ensure everything is properly sterilized. We have mechanical indicators. And so what you see is something that we tend to all use, okay? These are built into the sterilizer. They use microprocessing to just look at the temperature, look at the pressure, make sure the time is correct. Our chemical indicators are what you see in your set. It's all going to come together once you get in the operating room. Again, trust the process. You have a paper strip or tape, and it's going to change color. So once parameters have been met, so we're not saying that we can 100% guarantee sterilization, right? We can't do that. But what we can say is that the parameters have been met for the sterilization of these instruments. We have biologicals. These come in, they are most reliable. They specialize, or they have special spores that are used. If they are killed, the sterilization was successful. So we do a BI, usually the top of every time we open a machine, we put the BI in to let us know, okay, this machine is working properly. And then we have DART tests. These are air removal testing. This test checks to see if the sterilizer is effectively removing air from the chamber, which is going to be really important for proper sterilization. Again, we do not want an SSI or an HAI. Now, biological monitoring is, again, you may see this again somewhere. Biological monitoring is the most reliable method of determining sterilization parameters. So in the book 1013 kind of gives you an idea of a biological indicator. So make sure you go check that out. Chemical monitors, again, think about sterilization tape, strip turns colors. And then paper monitors where there's going to be like impregnated. And again, they'll be heat sensitive and they're placed inside every item to be sterilized. So when the instruments go in, they put that in there as well. And then they take it out just to make sure that all the parameters have been met for sterilization to have taken place. Now, when steam is pressurized, coagulate nucleic acids and proteins, they come in, they disrupt the cell's genetic material and enzymes, effectively killing the microorganisms. So it's a little bit of micro, right? It goes in and it destroys the cell's outer wall and the spores. And what this does is make sure that even the toughest bacteria and spores are eliminated. Again, putting the patient's safety, or putting them at the utmost, like they are the center. It makes the process so effective in killing harmful microorganisms. And that really is really important for us when we talk about our surgical instruments being safe for use. So, requirements: temperature, pressure, time. Those are the requirements: temperature, pressure, and time. So, question: how many requirements are used or needed for sterilization? Well, 3. If you see temperature, pressure, time, and air, well, air is going to be a process of elimination because temperature, pressure, and time. Okay. We also have gravity displacement. A lot of smaller facilities will have these smaller instrument sets. A lot of times in dental, so a lot of oral maxillofacial places that only do those, they're going to have smaller sets, okay, or smaller autoclaves. Now, with gravity displacement, steam is pushed out from the sterilizing chamber. Instruments are exposed to steam under pressure. You're going to hear me say that a lot. Exposure. So they're exposed. Now, if any air pockets remain, those instruments inside those pockets will not be sterilized. We'll call it like a wet load, where we have to break it down and re-sterilize everything. Okay. Sometimes you're going to be in a case and they're going to say, we need this instrument right now. And you'll have them do what's called a flash sterilizing, where you get specialized unwrapped items. So the item's not wrapped, it's clean, it's placed into the sterilizer for immediate use in a nearby operating room. It does happen. We're doing a case where, let's say, the surgeon has one of one instrument and he needs it for this particular case. It drops off the field onto the floor. He needs it, or he or she needs it. So someone's going to grab that instrument with a glove, clean it, and then flash sterilize it and get it back in the operating room. Only sterilize items that can handle high heat and steam exposure. So that means you're going to always check, usually with the manufacturer instructions, but oftentimes it'll be like a senior tech or someone there. Hey, trusting but verifying, like everyone's a team. Steam is created when water reaches 212 degrees Fahrenheit. For effective sterilization, the steam must be at least 97% water, which is just the moisture content. So you heard me say a wet load, okay? That's just too much, or the chapter says wet pack. So I'm using the terms we're using in the operating room, the wet pack, wet load. So this is too much moisture, leaves items wet after removal from the chamber. This can result in contamination of the item. So how does this happen? Well, when we open up the autoclave, we let the steam come out. And we usually keep the instruments in there for a good 30 minutes before we pull it out to let the instruments cool completely. But let's say you pull it out too fast and put it right on to the drying rack without letting it cool all the way, then moisture does kind of build up in different places, and that's where we get the wet load. But let's say you're at a bigger hospital and you have a bigger autoclave. This is what they look like. You place instrument pans flat on the shelf, kind of like you see here. Linen packs should be on their sides if they had it, but these aren't linen. This is woven, just so you know. You don't want them to touch. So if you notice, there are little gaps in between each pack. If you have heavier sets, most likely these are these ones on the bottom, because it makes sense because you want heavier on the bottom. If there were any basins, jars, cups, they're also going to be placed on their side. Why do you think we place them on their side and not having them sit up? What do you guys think? Exactly. You do not want anything to pool. Great answer. So you put them on the side. So if there was any liquid that was going to go in, it's going to slide down during the drying process. Now, I mentioned flash sterilization. So let's see if you guys remember. When should a flash sterilizer be used? So this is a question you may see, but this is something that you may actually experience. When should a flash sterilizer be used? Think about what we are actually doing. We're already in the case. Would you use a flash instrument if you need it for the next case? Or the surgeon's asking for it right now when there is no other alternative and we need something sterile? Yes. So keep in mind, this may happen. An instrument is needed right away. Yes. Maybe it was dropped or contaminated. That is correct. You may be in a situation where you say, hey, I need this instrument flashed. And they may be like, oh, but we have this. And you're like, no, the doctor wants this one. We need this one. Okay. Great answers. We also look at ethylene oxide, used for items that cannot handle heat, steam, or moisture. These are going to be um, able to penetrate, again, all parts of the object, just like the other claves would. But remember, these are delicate. They cannot handle heat, steam, or moisture. So it works at a lower temperature compared to steam sterilization, but it is a flammable liquid. And that liquid does essentially the same thing. It kills all microorganisms, including their spores. So it's going to be ideal for sterilizing sensitive items because of its ability to penetrate and sterilize without like that high pressure heat. Okay. With EO, ethylene oxide, items must be free from organic material and completely dry. Organic material, blood, tissue, that's all got to go. We can't have any bioburden. So you hear me say that term again, bioburden. These are going to be organic material left on an instrument after a case is over. Any leftover can create toxic residue during the process. So here you load items loosely because you want the gas to get to all of the parts. Group items that have the same aeration time, meaning items that have the same drying time. Okay. Do not let packages touch the bottom or the top of the sterilizing chamber. So you're kind of pulling them in, giving space all around. Think about it. If you have it touching the walls, it's not going to have room for all of the steam or even the sterilizer material to touch every aspect of that item. And with aeration or the drying time, items may take up to 12 hours after you've removed it for the gas to completely be out of the item. And I try to get images so you can kind of see how the machines look differently. With gas plasma, these are going to be used on items that are heat and moisture sensitive as well. Shorter cycle than ethylene oxide. Vapor is created by hydrogen peroxide. There are radio frequencies that are transmitted throughout the vapor, and they come in and they destroy the cell membrane, genetic material, and the cell enzymes. And then we look at liquid parasitic acid. We use these a lot of times for our EGDs and colonoscopy cameras. But you see on the term oxidation, what does that mean? What do you guys think oxidation mean? Like break down the word oxy and then dation. What does it mean? It's a Greek word, if that helps a little, meaning sharp or acidic, and it deals with oxygen. So I'll give you, well, I'll break it down. Okay. So I'm gonna put it in broader chemistry terms because this isn't a chemistry class. Um, I want you to think of a reaction where one substance loses electrons, or in this case, oxidation, while another one gains electrons or reduction. So it's the process of oxygen, specifically a chemical reaction. We're talking about parasitic acid in this particular case with our liquid parasitic acid machines. And the chemical reaction loses electrons, where the oxygen is the reactant. So it doesn't leave, the one thing about it is it doesn't leave a chemical reaction, but we do still rinse off these instruments thoroughly. And then we usually hang them to dry, at least on the ship. That's what we did. We would have it soak because the ship, it was a little bit limited into what we could do. We would rinse it and then let it um, dry completely before we use it again on another patient. Now, with ozone sterilization, this is a molecular form of oxygen, or O3, at low heat. It's ideal for moisture and heat sensitive instruments as well as equipment. It is environmentally friendly as it breaks down into oxygen, but it must be approved by the manufacturer for specific items. So just keep that in mind. Okay. Cobalt 60. Okay. Used for sterilizing products that were traditionally sterilized by dry heat. It is an alternative, more efficient method of sterilization, especially for materials that can just withhold all the heat. Okay. But why did we move away from dry heat? Well, one of the biggest things is dry heat can cause changes in the composition of items where they'll start to deteriorate. Okay. And we don't want to have something that could potentially deteriorate in a patient's body. Okay. So ideally, these were intended for single use items so that it's not a big deal. A lot of them will be manufacturer items. These are going to be our disposable items. Okay. A lot of them are sterilized by cobalt 40, just in case you see a question like that again somewhere. Okay. It also really highlights the shift towards a safer and more effective sterilization methods. All right. One thing that I really wanted to have you guys see before we get out of here, we talk about Creutzfeldt-Jakob disease, where prions are not destroyed. I feel like this is important because it kind of shows us what can happen if our instruments are not sterilized. Okay. It's about a 5-minute video. It was uploaded December 13th, 2022. This is a rare and fatal neurodegenerative disorder caused by abnormal folding of proteins known as prions. And this is a kind of animated overview of the symptoms, the causes, the diagnosis, pathophysiology, and the management. Keep in mind that there are 4 types of CDG or CJD that are talked about in the video. So let's take a look before we get out of here this evening.
The brain is an amazing network of neurons. Nearly every task of a neuron is carried out by an army of proteins. Proteins are like a highly specialized working community. Very rarely, an error in the system can make a group of these proteins stop obeying commands and start a fatal rebellion that our brain and body cannot survive. Today on Tiny Medicine, I will illustrate the rare prion disease, Creutzfeldt-Jakob disease or CJD, from a doctor's perspective. This is Anthony. Over the last 3 months, he rapidly developed a memory impairment. The disease first took away his short-term memory. But now, Anthony functions almost like a baby who doesn't know how to get dressed or how to use the toilet. All of these cognitive symptoms indicate rapidly progressive dementia. This is him who has got lost in his own garden. By the way, did you notice a non-cognitive abnormality with Anthony? These quick, involuntary, jerky movements are called myoclonus. Now let's ask him to walk. Do you notice any abnormality? Yes, his gait is unsteady. We call it ataxia in medical vocabulary. Rapidly
Let me move the video to its own page really quick, because I heard that you guys can't see the video. So give me 1 second and I'll just put it on its own page. Okay, and then let me share it with you guys. And thank you for letting me know, because I'm all like, this video is good. Okay, can you guys see that? Okay, let's play. So
The brain is an amazing network of neurons. Nearly every task of a neuron is carried out by an army of proteins. Proteins are like a highly specialized working community. Very rarely, an error in the system can make a group of these proteins stop. Developed a memory impairment. The disease first took away his short-term memory. But now, Anthony functions almost like a baby who doesn't know how to get dressed or how to use the toilet. All of these cognitive symptoms indicate rapidly progressive dementia. This is him who has got lost in his own garden. By the way, did you notice a non-cognitive abnormality with Anthony? These quick, involuntary, jerky movements are called myoclonus. Now let's ask him to walk. Do you notice any abnormality? Yes, his gait is unsteady. We call it ataxia in medical vocabulary. Rapidly progressive dementia and myoclonus are key symptoms of the prion disease called Creutzfeldt-Jakob disease. Let's have a close look at this brain cell. Ribosomes are the factories that make proteins, but to become fully functional, proteins have to fold into distinct shapes. Prions are a subgroup of cellular proteins. After the folding, they travel to the cell membrane to perform their duties. They cause no harm as long as they are properly folded. Very rarely, due to some unknown reasons, prion proteins can be misfolded into an abnormal shape. Abnormal prion proteins act like brutal conquerors. Not only do they self-replicate, but they also convert normal proteins into abnormal proteins in a chain reaction. Accumulation of misfolded proteins leads to cell death. After killing one neuron, they spread to the nearby cells and infect them as well. There are 4 ways you can develop Creutzfeldt-Jakob disease. Around 80% of the CJD cases are sporadic, meaning that the abnormal prions were made without a known trigger. Around 15% of the cases are familial, in which a mutation of the prion gene is inherited by the offspring. Iatrogenic CJD occurs when the infection is spread from one person to another through medical or surgical treatments. This reflects the fact that prions are highly resistant to disinfection and sterilization. Before 1985, when artificial growth hormone was unavailable, children with growth hormone deficiency were treated with hormones extracted from pituitary glands of human corpses. Unfortunately, some of them went on to develop iatrogenic CJD later in their lives. This last form is called the variant CJD. It is caused by the same prions that cause mad cow disease in cattle. Humans can get the variant CJD when they consume food products infected with prions. Human infection can be prevented by using strict public health measures. If you take a biopsy sample of the brain and observe it under a microscope, you would see a sponge-like appearance with lots of vacuoles. That is why this disease is also known as spongiform encephalopathy. But in real life, brain biopsies are not often conducted in living patients. Instead, doctors use clinical criteria to come to a diagnosis. Anthony's first significant investigation was the EEG study. Doctors were able to detect abnormal electric signals from his brain. Then he was subjected to an MRI scan of the brain to detect abnormalities associated with the disease. And finally, doctors performed a lumbar puncture by inserting a needle into his lower spine and took samples of cerebrospinal fluid, or CSF. Prion proteins in CSF can be detected by a special technique called RT-QUIC. Detection of prion proteins in CSF strongly indicates CJD. There is another protein called 4-1-33. It is not a prion protein, but it gets released into CSF in people with Creutzfeldt-Jakob disease. Anthony's health rapidly deteriorated in the next couple of months. He eventually became mute and motionless with rigid limbs. This is a special type of coma called akinetic mutism. Whenever a person becomes motionless, they are in danger of getting infections like pneumonia. Unfortunately, there's no cure for Creutzfeldt-Jakob disease. Doctors explained the course of the disease and prognosis to Anthony and his family. A few months later, Anthony passed away from pneumonia. Most people with CJD die within 1 year from the onset of symptoms. After the death, a post-mortem autopsy of the brain confirmed the diagnosis of CJD. If you enjoyed this video, I recommend watching my animation about the locked-in syndrome. Thank you. I will see you
All
soon
right, so
with
I
another
really
interesting
like
medical case.
this particular journal
What has
because
lasted
it brings
5,000
up.
years was
Okay,
once
let me get rid of all
almost
this stuff. Hold on,
lost.
guys. Now it won't let me get rid of everything. I really like that channel because it like breaks down different things from not just our point of or this like the opposite point. Like it explains why this is happening, right? Like we can see our part, but it helps to understand someone gets this, let's say, because an instrument wasn't properly sterile, and to know that they literally have a year, right, from the onset of the disease manifesting in their bodies to kind of losing function. Okay. As you see, it's the prions, it's breaking it down. We're going to talk more in micro, but it ties in together with this particular chapter. We're talking about why it's important for us, or we already talked about it in micro, why it's important for us to keep our instruments sterile. So another reason why we learned all that in module 2, right? It's a lot of information, but then it starts to come back around when we get into the first part of module 3, talking about decontamination and sterilization of our instruments. We don't want to be that team that you find out later that, oh no, this particular patient has this disease or that disease. And then what do we do? Right? So as you can see, there is a couple more things in the chapter. We're getting close. Things that I want you guys to kind of look at. Disinfections, glutaraldehyde. That's going to be one that we use quite often in the operating room. All right, so let me grab a picture so you guys can kind of see what we're talking about. Again, this is one we use quite often in the operating room. The one big thing about this particular disinfectant is that it can irritate your eyes, your nasal passages. So we usually wear masks, and it can cause dermatitis if it touches sensitive skin. So again, you want to make sure you have on gloves. We look at the levels of disinfection. At your field, you're manually cleaning. This is the very first step of disinfection process. You have a sponge. Typically, I usually use a Raytex. I keep it on my mayo stand and I'm constantly wiping down my instruments, okay? I'm physically removing the debris, the organic material, the blood from the instruments. Then the second is high level disinfection. The third is your low level, okay? Where now you're killing most of the bacteria, some viruses, but this is more of a low infection risk. With low level disinfection, I want you to see what we're wiping. This is the first thing we do in the operating room. You'll notice in the video that I'm going to share with you around week 5, where I break down and I do a whole cleaning the operating room, going through my surgeon's preference card, doing my initial hand scrub. Okay. You will get that video. And I'm wiping down all horizontal surfaces. Low level disinfectant. We look at environmental disinfectants. We have our disinfectants that are used in restriction. We have our quaternary ammonium compounds that do not have to be soaked in any hard water. We also have hypochlorites that this is the one that the CDC recommends the use in like spot cleaning of blood, okay, blood spills, because it's very fast acting. And then alcohol. With alcohol, we use it at a 60 to 70% dilution. Something that you might want to remember, just 60 to 7% dilution. I have seen that question. Again, I know they come from a pool, but you never know. You may get that one. Other things the chapter talks about: sanitation or disinfection, cleaning surfaces. Okay. In the operating room, you're going to be exposed to blood spills, or contamination. So what we do is we promptly remove with a high grade disinfection that we use in the operating room. We're not using household bleach. We're not bleaching the place. We have approved disinfectant. And then we discard all items used during surgery. It has to be placed in a leak proof container to prevent spills of contaminated fluids. All right, so Kahoot's gonna be sent to you guys. So I will send you guys out the Kahoot. But with that, we looked at gas sterilization, which is crazy because it was only one section left in chapter 10, and you see how much we had to cover. We looked at special processing. I really wanted to break down CJD to kind of put things into perspective. Okay. Difference between disinfection and sterilization is really important. There are going to be hazards. We are in a high risk field, right? And the one thing that we do at the end of a lot of cases is terminal cleaning, where we clean from top to bottom. Like, we're cleaning the walls, we're cleaning the ground, or the floor, everything. For those of you who are watching, what are the critical steps in the sterilization process? Why are these steps important? And name one potential consequence of improper instrument reprocessing in surgery. And we watched a video, so hint, hint. Quote of the week: everything you want is on the other side of fear. What questions do you have for me? Okay. Now, for those of you who are here, if anything does come up, if you notice something, let me know. I am going through everyone's emails. If I haven't responded back, please give me a little patience. I'm going through, trying to respond to all the Moodles, all the text messages and emails. So if I haven't gotten back to you yet, I am getting back to you. I just want to make sure everything was graded for my classes. If there are no further questions, I do want you guys to have a wonderful evening. If you are near the fires or have been affected, you are in my thoughts. If you guys need anything, you guys, please, please, please reach out. We are one team, okay? So do not feel like you're alone, because you're not. All right. Okay, perfectly. Let me I will get that so offline. If for some reason you still need the instruments, I am going to post them this evening in announcements, and I'm going to send a link to that announcement with that email so it has everything for you. Okay. I thought I did it, but to Aries, to Aries humans, a lot going on. But thank you guys. I will get that to you. Make sure you utilize the template. Answer the questions, okay? Get the maximum amount of points. With that, I look forward to everyone who can meet on Wednesday, and good night.